is AI also on your radar? Something you want to explore, and some tools or some automation you want to bring in order to improve overall, and I think offload a lot of your administrative burden to that.
Yeah, yes. AI has been very instrumental in our evolution, especially in the last few months. We our Athena Health, our electronic medical record, has an AI feature for documentation and dictation. And so we use that right now. That has helped us improve our completion of encounter closures. And then our front desk answering service is an AI feature from that third party. And so that one right now has been answering our calls, especially when we're with patients or we're busy in clinic, we can't answer the calls. The AI assistant is answering it on our behalf, receiving messages, and then we're able to check those messages thereafter.
Welcome to the Convergence Play podcast.
Thank you so much for taking out time. I know you must have a busy schedule, but we really appreciate you making time for this.
My pleasure. Thanks for
I
the
was
invitation.
I was reading the website for your clinic, and it mentions that you are commonly referred as Dr. E. That's what I think you should be using, or you would prefer your first name?
First name is fine for this. My patients call me Dr. E, so it
Oh,
works out.
okay,
But yeah, no, it's fine.
thank you so much. And it seems like a great setup you have. And I think what we would love to do is learn more about that, and basically what you are doing, what you are building, what is the big picture, your vision. And of course, we would also love to learn about challenges that you have overcome. And likewise, what is your roadmap for next 3 or 5 years? So with that, I think the best starting point will be if you let us know for all our audience what CYCC is and what is your vision and mission behind this.
Sure thing. Yeah, and thanks again for the opportunity to share. The Introduced Clinic and Consulting was born in 2021 out of a desire to redesign how we deliver care to youth and young adults. So my background is pediatrics. I did a residency in pediatrics, and I was trying to figure out a way to combine my interest in the brain, neurology, psychology, social work, and I found the field adolescent medicine was a one that I can combine all of that in one space. And so I did a fellowship in adolescent medicine and been working in different settings, whether it's group practice, community health centers, and I just felt that there was a way that we can communicate with young people better to prepare them for adult models of care. And so I think trying to do that in other settings was a bit frustrating because, again, it's hard to change large institutions to innovate. And so I decided to start my own practice to see if we can test out some models. And so our main focus is to integrate community health promotion in how we deliver healthcare services. And someone said, well, we already do that, when we encourage them to eat fruits and vegetables, or we encourage them to those. But I found in my other hat as a youth ministries director in church that these young people, when they're in the community, they're not really understanding a lot of the medical speak, or not really understanding a lot of the plans that were recommended to them. And so I learned that they really need like a whisperer or interpreter, like, hey, my doctor said this, Dr. E, what did they mean by that? Or my provider said this. And so I felt like there was a communication gap that was lacking. And so I just wanted to create a system where we can really think of how we communicate with young people and be in their settings, take the healthcare beyond the exam room into their spaces of learning. We have programs in our clinic that share information with kids in schools and in community fairs. And so So that's kind of like the premise of CYCC, is centering young people to be able to manage all parts of their life because they're all connected. So one of the things that, oh, I don't know if I kind of shared like the overview in
Sure,
general.
sure.
Did
Please
that
go
answer
ahead.
your question?
Yeah, yeah, absolutely, absolutely. And thank you. And when you were talking, I realized it's a wide spectrum of services that you are providing. Like it's not a specialized one or two services. There are a huge list of services that you are providing. And I was thinking about, okay, what might be the day-to-day challenging in your job. And of course, I think being a founder, apart from providing the care, I think you must be navigating many other challenges on in your day-to-day activities as well. So it would be interesting to know what kinds of hats you wear in order to keep this thing running.
Yeah, yeah. Um, Definitely challenges. We're going up to 4 years next month, that we've been in business. And I think the first thing that I knew that I couldn't do without is having stakeholders be involved in the planning. And so what does that mean? It's like, yes, we can have business people, we can have clinicians and providers. I have staff, medical assistants. But if I didn't have young people as part of my planning, I felt like I would miss the mark still. And so we have an ongoing relationship since we started with the university locally, where we have pre-health students who volunteer their time. Sometimes they do internships in my clinic during the summer, where they are ingrained in our infrastructure. And so as we're making plans, as we're developing different policies and protocols, they tell us what they want better. You know, even when we're building out, like we were designing our space, we have a new space now. And the young people, these are college age, were like, no, it'd be great if we walked in and if we need to give a urine specimen, like just really helping us understand the flow of the patient encounter. And so that was interesting to find out how to do that formally, because in other spaces it's almost like a side thing to get
Yes.
feedback, but we have it ingrained in our infrastructure. Communication through tech is always something that we continue to evolve and are still evolving in doing so, where it's how do we communicate more clearly to patients beyond just having a portal. Like having a portal is great, but like how do we encourage our families to use it? How do we communicate with them across the portal in a timely manner? And then if we want to sort of like celebrate our patients beyond here are your test results and here's your appointment, how do we do that? Like whether it's celebrating birthdays, whether it's just checking on them after an appointment and having like a routine, where we had a third party tech company to help us set automation to be able to check on patients within 5 days after their appointment, say, how are you doing? Is there anything that we missed? Is there anything that we need to sort of like address? And that has saved me, because then I'm not waiting for 4 weeks or a month or 2 months later for them to come back and say, oh, I never started my medicine, or the insurance didn't approve this. We're able to get those barriers to continuity of care. We're able to address that sooner. So I found that I wanted to use tech a little bit more to help me manage all the things I need to manage for patient care. And then, of course, in a environment where it's turnover and work and just trying to keep people in business, that's always a challenge. But I think it's creating systems where information doesn't get lost. Let's say someone transitions into a new position outside of your practice. It's like, how do you retain what they learned so that the next person coming in is able to sort of follow through with how the clinic runs, and so we don't miss a beat. So that definitely has been something that we've instituted over the years to have our own policies and practices that are steady.
Okay, understood. Thank you. So, how big is your team right now? How many caregivers, and if you include everyone else?
Yeah, we're pretty small. Because we started as a direct primary care service where we wanted to make sure that we make time for patients. So at this point, it's just me, and a medical assistant, and then I have a college volunteer coordinator I have 2 of those, and then I have a nurse practitioner who helps manage some of the youth programs that we do in the community.
Great. So I always am super excited about this question is being an organizational leader, you have to bring in the culture of excellence and culture of patient centricity. I think being at the topmost position, that becomes your top notch priority to whoever is working for you should have customer patient centricity as the first priority. How
Mhm.
do you bring in or instill that culture in your organization?
Yeah, that is a very big part of how we operate in our practice. Um, we have, a hashtag in our clinic. It's for the kids. Is that whatever we do, we're centering the kids in all our dealings. Um, there are a lot of administrative, sort of like logistical things that go on, but I think it one starts with organizational culture. It's like if you have moments where you're refining your vision, vocalizing your vision, sharing it with staff on a regular cadence, then it'd be less about them getting frustrated in areas, but them seeing why are we here, like reminding them of their why. And at the end of the day, a lot of us enter this field to serve, to serve our patients. And so I think having a way to remind the team of that mission is key. So we do that through daily huddles. Like every morning before we start the day, we look through the schedule and we talk through some things that we know, some patients who have certain preferences, whether it's our patients who are, who have preferred names, transgender patients who have preferred pronouns, nicknames, any nuances. We have a note section in the chart that pops up that says, "Don't forget this, and that about this family," so that we're again bringing it to be a personal experience as opposed to a transactional experience in the care. And if you check out some of our reviews, some things that people like is that we actually remember their names. And in our EMR, it has a place for us to put a picture in to help us sort of like stay grounded in that. But it's great to have the knowledge to heal someone, but if they don't know that you care, if they don't see that you care genuinely, then they might miss all your
Efforts.
expertise.
Yeah, understood. And I think, of course, a leader has to lead the way. And of course, the culture always starts with how the leader of the organization is functioning or behaving. I think people follow that more than anything else. So I think the big credit must be the way you yourself is leading. So I want to linger on a little bit because one of the interesting things you mentioned was your dependency on tech to provide better care. I think this is something which we talk to many companies and many hospitals and many organizations, and this is something which is really interesting is that there is a chunk of hospitals who are reluctant to use latest tech. So you mentioned that, and it seems like tech is really helping you with the workload and everything.
Mhm.
So do you mind sharing a little bit more of what kind of systems you are using right now to provide better care than your competitors?
Yeah, I mean, I would hope that I'm providing great care, and so hopefully others are too. I can't say that we're better, but we're definitely doing our best to do what we can. Right now, we're just using Athena Health, which provides our electronic medical record systems. And we've, over the years, needed to contract out with third party to improve our patient engagement piece of the tool. And so that is still where we're sort of like exploring options. We haven't quite yet finalized one place, but we were using Next Health and still are in some ways, but we're exploring another company called Funnel Cake right now, and they're pretty new. So, but we're still exploring patient engagement. I think Athena is starting to have upgrades for um, for patient engagement, and so we have actually a training on Wednesday to see how they have sort of like upgraded. But that's who we use right now is Athena Health.
That's great. So, are you also looking into integrations of other healthcare applications as well in order to improve your overall system? For example, with EMRs, there are many other components and many other systems you can integrate, and that can further improve the quality of care. Is there something like that on your plan at the moment?
Um, not as of right now. We're currently trying to explore one avenue, so we haven't quite finalized, but we've not explored any other as of right now because we're still looking at this one.
Right, understood. One thing came to my mind is a lot of clinics they rely on telehealth as well in order to reduce their burden. For example, if patient have just need to consult with doctor and there is nothing critical, they just need to talk and have one or two of their doubts cleared. They are typically using telehealth in in situations like those. Is
Mhm.
this something you are also using or on your roadmap for future?
Yes, ma'am. Yes, sir. We are using telemedicine.
Okay, that's great. And if you have to just ballpark the percentage of your patient consultations, how much percentage is on telehealth and how much is in person?
And by and large, because I see like young children and teens, young adults, I would say majority of those young children are coming in person. So I would say about 90% of my visits are in person.
Right. Understood. So you mentioned one third party you work with for tech. Are there any other third parties as well which you interact quite often, or you are still in an early phases and don't have a lot of vendors to work with?
Yeah, I haven't really explored other vendors. My priority in exploring vendors is seeing who is already able to sync with Athena Health. Because what happened when I first started this practice is that I had about maybe three different platforms I was managing separately. Before I went to Athena Health, I had a different EMR. And so that EMR didn't communicate with any other ones. It was great for what I needed, but I needed to minimize my workload and needed to sort of like transfer information across platforms. I needed something that would speak to each other. And so my preference right now is integration.
Integration. Yeah, understood. So on the same track, uh, if we just look at the future 2 years or 3 years from now on, and I think we can safely say that technology is going to penetrate more and more into healthcare, and especially AI is going to handle a lot of tasks, and especially administrative tasks that are at this moment eating up a lot of time on clinics. Uh, is AI also on your radar? Something you want to explore, and some tools or some automation you want to bring in order to improve overall, and I think offload a lot of your administrative burden to that.
Yeah, yes. AI has been very instrumental in our evolution, especially in the last few months. We our Athena Health, our electronic medical record, has an AI feature for documentation and dictation. And so we use that right now. That has helped us improve our completion of encounter closures. And then our first, like our front desk answering service is an AI feature from that third party. And so that one right now has been answering our calls, especially when we're with patients or we're busy in clinic, we can't answer the calls. The AI assistant is answering it on our behalf, receiving messages, and then we're able to check those messages thereafter.
Understood. Understood. And we also saw that, just throwing an idea out, not sure if you're already using or not. We have also seen that clinics like yourself, they also have AI modules that provides very easy appointment facilities to their patients. So they can simply use a WhatsApp number or something like that. So they send a WhatsApp message, and then there is a AI integrated with a WhatsApp number, guides patient with the next steps of setting up an appointment. And actually appointment is set up, and then this appointment is also reflected inside EMRs as well, any EMR. So there are a lot of clinics who are actually providing this facility to their patients, that they can simply interactively chat on a WhatsApp number to get their appointment done in the system. If not, you're not doing that already, but I think it may be something worth exploring for you.
Great. Thank you for that.
Thank you. So I think we talked a lot about technology piece, and of course, it's great to see that it's something you are relying more and more. And if just one question from my side on your current technology vendors, uh, are you looking at some expansion in that, or do you feel that your current vendors are providing you with the uh, with the required level of services?
Yeah, I think for now, we're satisfied with how we are operating. Because it's a new transition, and so we're just one thing I'm learning too is try not to make too many changes
Right.
where patients then get confused as to like where do we expect information from now. And so I think right now, because we just started this process in the fall, and so we're still new in it. So I like to give things at least 6 months before I call it, needing to pivot, because I've done that with some vendors. But so I try to just take my time to ensure that we've exhausted and optimized all aspects to ensure that we get what we're looking for.
Because of course, bringing in new vendors is a lot time consuming, especially from your perspective. Not only due diligence, but once you have finalized somebody, the onboarding process also
Mm-hmm.
takes
The
a lot of efforts.
onboarding.
Yeah. So
Yeah.
totally understood. So thank you. I just want to ask you, of course, with your journey, there must be many challenges you encountered, and of course, there is always a stage when uh, there are surprise challenges coming at you. Things are no longer simple. Things are no longer straightforward. So you started in 2021, and when exactly you realized that this thing is growing, scaling, and it's not as simple as you might have thought
Yeah.
start.
I mean, I think because we started 2021 just building the infrastructure, we didn't start seeing patients until a year later, 2022. But I think from then till 2023, I think is when I started realizing this thing is here to stay, but I need to keep up. And that was when we made the transition from our previous EMR to Athena. It was around that year mark after we started seeing patients, because I realized we needed one complex um, systems to manage payment methods and insurance, and because initially I was only going to do subscriptions with direct primary care, and later on I just had patients who had insurance who were seeking our services, and I needed a system to manage all types of, transactions. And so it became a lot to manage in a piecemeal form. So I would say, yeah, that was the first sort of like turning point, is that we're growing faster. More patients need to hear from us in a more timely manner for certain things. And there's so much in the ether when it comes to managed healthcare,
Right.
that yeah, it's hard to do everything by phone. Like some things just need to be automated.
So if again coming to the big picture, so what is your vision for next, let's say 3 to 5 years? Where you wanna go? Where you want to see your organization growing into?
Yeah, in 3 to 5, I'm gonna start with 3 years, because in 3 years, my hope is that um, we no longer are still exploring patient engagement tools, and that our patients know to expect communication from us, whether it's on a monthly basis through a newsletter, whether it's on a cadence after their visits or before their visits, they're getting information from us, but they know to expect it. Right now as we evolve, it's still sort of like, what? So I'm hoping that in 3 years, we don't have to question what our communication plans and platforms are. Um, Other things I think a little further would be, how do I communicate with, um, I would say, non-patients? Because right now we're just focusing on who's within the house,
Right.
but it'd be great if we think about marketing, if we're thinking about expanding our reach. What does that look like? Knowing what we, provide, knowing the services we provide, how do we communicate that to a broader audience? I don't really pay for marketing, knock on wood, at this time. But we stay busy from word of mouth. But I think as we grow, it'd be great to sort of like start packaging and communicating to others what we do, so that our reach is wider.
So, if I may ask you, typically, how many stakeholders are involved in your patient communication, the patients and the family members? So, on average, so what is the number of stakeholders?
Yeah, I mean, right now we have about 700 or so patients in our panel. And I would say on average, majority of them are parents, of course. And then we have a good quarter who are college students and young adults who directly communicate with us. And so it's a mixture of who it is that we're engaging.
So, just asking for the sake of clarity, do you have budgets defined for your patient engagement initiative? I'm sure as you are looking to accomplish a good progress in that in coming months and years, do you feel do you have right resources and right budgets and right planning in place in order to take care of that?
I would say that's still a work in progress. Because I think we're just expecting what we have budgeted in the past year. We have not expanded that budget as of now, because we're just trying to replace our previous system. I think when we start exploring more features and more things we want to do with that, I think right now we're trying to get something consistent and steady. And so we haven't budgeted beyond what we used last year.
Right, got it. Okay, thank you. So a lot of founders also, people who are starting their business or thinking to start their business in healthcare domain, they often listen to our podcast and interviews. And if you have to give one advice to someone who is just starting or is thinking to start a business like yourself, what that advice will be?
Hmm. Very good question. I think the first thing I would say is really hone in on who you're looking to serve, because sometimes that's where you're going to get your source of strength to keep going when the times get hard. I can't tell you how many times I'm like, I'm done with this. This is too much. But then I'll have a patient that sends a message or a family that comes in, and something about um, reminders of why you chose to go the path less taken, I think will be very important. Um, and ensuring that why is beyond yourself. Sometimes if you depend on yourself, you might forget
Yeah.
yourself. Like, why am I doing this? But having those around you that help you remember your why will be important. And then never give up on learning. I can't tell you how many skills I've picked up along the way. Like, I can code, I can build, I can run a website, I can change a website. Like, I all these little codes in the back end and drop down. Like, yeah, they didn't teach me this in med school. And so I think being open to just learning, yeah, learning, being open to learning and knowing that you're going to continue to learn as you grow until you get to a point where you know enough to hire somebody to then do the ongoing day to day of it. But it's important for you as a business owner to have some high level. It doesn't have to be integrated. Like, I don't need to be all in the weeds, but I
Yeah.
need to understand a basic concept of your role in that particular skill set.
Okay. Thank you. This is so powerful, and I think somebody told me the similar thing, that when you are about to give up, always think that why you started it.
Mm-hmm.
So this can
Mm-hmm.
be a good this can be a good
Mm-hmm.
motivation to keep going. And I really appreciate your time, sharing your wisdom, sharing your experience, and just to share a little bit of insight, because we communicate with other founders as well. One great thing about CYCC is what you are trying to do is rely more and more on technology. So it's a very good positive side of your organization, that you know what you need from technology. You are trying to do your best with EMRs you have right now access to. And likewise, what you are trying to do is bring in more and more technology. And seems like you have a roadmap in your mind about technology adoptions as well, which is really positive thing. And of course, with your passion, with your vision, with your efforts, I'm sure CYCC is going to accomplish what you are hoping for to it accomplish in next 3 to 5 years. So thank you so much for your time, for sharing your experiences, and we hope to get your story out to a bigger audience in coming couple of weeks. Do you have any question or anything for me? Please let me know.
No, thank you so much. This is fun. It's great to have opportunities to reflect on the journey and not just be on the journey, but pause and to reflect on it. So thank you for this opportunity to do that.
Absolutely, and we will be in contact. Definitely, if I come across something, some tools, some approaches that can help you improve your day-to-day operations, I will be in touch and keep those sharing with you.
Thank you very much. I appreciate
Thank
it.
you. Have a good day.
Bye.